Medicine in the Industrial Period, 1700 to 1900. In the mid-18th century, various machines were invented that were powered by water or steam and could work more quickly and efficiently than manual workers. The use of machinery in agriculture meant that there was less work to do in the countryside, and therefore many people moved to the rapidly growing towns such as Manchester and Leeds to work in the new factories. In these urbanised towns, the standards of workers' health was usually very poor, and disease spread quickly. In 1800, governments believed they should interfere in people's lives as little as possible. If people were unhealthy, that was their business. By 1900, Parliament was making laws to improve people's health, forcing changes on people. This would have been unthinkable a century earlier. In 1867, working men were able to vote for the first time. It was still only a minority of working men, but a major change had taken place, and in 1884 the numbers were increased. Now politicians had to make changes to win the votes of working men, and this led to major reforms aimed at improving health. Industrialization was not just about coal mining and mills producing cloth and clothes with wool and cotton. Developments in steel making helped to produce a thin syringe needle that did not break. Improvements in glass making led to better microscope lenses and better thermometers. Communication was also revolutionised. Trains allowed scientists and doctors to travel more quickly to attend conferences and learn from each other's ideas. News was reported more quickly, especially after the telegraph was developed in the 1850s. So details of scientific experiments could be reported in other countries on the next day. Scientific journals spread detailed accounts of new medical methods so they could be used worldwide. Causes. In the early years of the industrial period, the most popular idea about the cause of illness was bad miasmas. This made even more sense in the early 1800s when towns were more crowded and filthy than ever. A second dominant theory was spontaneous generation. It was argued that disease was caused by germs that were produced by flesh and vegetables as they rotted. However, during this period, there were a number of vital breakthroughs. In 1854, there was another outbreak of cholera in London, and Dr. John Snow used it to investigate his theory that cholera spread through infected water. He marked on a map all the deaths, and there was a clear concentration of deaths around a water pump on Broad Street. Snow had the handle removed and the number of deaths dropped dramatically. In 1861, Louis Pasteur developed the germ theory. He had already observed unwanted microbes in wine and vinegar that turned it bad. He carried out experiments and made the link between microbes and disease. He did not fully publish his theory until 1878, and his idea was not accepted straight away. Robert Koch then found that specific germs caused different diseases. Koch was the first scientist to grow bacteria in agar jelly, and he developed a method of staining bacteria using dye. He found the specific germ causing TB in 1882. Still influenced by Sydenham, physicians observed the symptoms of patients and could categorize diseases. After Koch's work on specific germs, laboratory tests started to be conducted to diagnose illnesses. In 1895, Roentgen discovered X-rays to diagnose broken bones and growths. There was increasingly accurate and detailed anatomical knowledge and physiological understanding. This was because the government passed the Anatomy Act of 1832, which provided cadavers for dissection from charity hospitals. Treatments. In general, medical treatments, other than surgery, didn't improve much in the industrial period. People continued to use laxatives, purging and herbal remedies. There was, however, less and less bleeding. There were even more patent medicines than before, and many of these were dangerous, claiming to be cure-alls, but containing ingredients like arsenic. They did start to become safer after 1880 when they became under government control. Although surgery had become more scientific by the end of the 18th century, people usually had to be desperate before they agreed to have an operation. They knew that they would suffer great pain, and many patients died during the operation. However, even if they survived the operation, many patients still died later from infection or blood loss. Lady Mary Wortley Montagu, the wife of a British diplomat in Constantinople, discovered that inoculation was widely practised in Turkey and that it was considered safe and effective in preventing fatal smallpox. She had her children inoculated in 1721. This prompted intense interest in inoculation in England. However, inoculations were dangerous. Having observed that milkmaids who had caught cowpox never caught smallpox, Edward Jenner successfully tested his theory that they must be connected on a local boy. He published his findings in 1798. Jenner faced public opposition, but by 1803 the government paid for smallpox vaccines, and by 1853 had made them compulsory. This led to Pasteur later making a vaccine for chicken cholera, rabies in 1885, and by 1896 typhoid and cholera. Due to the reports on the causes of death by Chadwick and Farr, the Great Stick of 1848, and working men getting the vote in 1867, the government adopted a less laissez-faire attitude to public health as the 19th century progressed. In 1865, 1,300 miles of sewers were built by Bazalgette. By 1875, after passing various other acts to improve public health, the government passed the 1875 Public Health Act. This forced local councils to provide clean water, public toilets, proper drains and sewers. It also forced them to remove rubbish, pave streets and improve the quality of housing. The Artisan Dwelling Act was also passed in 1875. This removed some slums. Care. For those that couldn't afford to visit the doctor, housewives were still used for basic medical care. Apothecaries, increasingly trained via degrees and having to pass exams, later became professionalised pharmacists. Professional surgeons, trained via degrees and having to pass exams, conducted surgery in houses and later operating theatres. In 1854, Florence Nightingale went to Turkey to manage the nursing of British soldiers wounded in the Crimean War. Here she gained the nickname the Lady of the Lamp. After improving the conditions within the hospital, the death rate among wounded soldiers dropped from 42% to 2%. Upon returning to England, Nightingale raised the government's awareness on the state of hospitals in Britain by writing an 800-page report to Queen Victoria. By 1860, she had established the Nightingale School for Nurses in London. She published notes on nursing about practical care and high standards in 1859, and she wrote over 200 books about hospital design and organisation. People were treated in houses, private hospitals, voluntary charity hospitals, local government hospitals, workhouses or pest houses. The standards of care and hygiene in these places were varied but improving.